Hi, everyone. Hello, nephew community. My name is Alf Carroll. I am a nephrology clinical science liaison up in the Boston area, covering the New England territory. Thanks for being with us today for our Voices from the Community podcast. Today, we are excited to talk about healthcare challenges in the transgender community, and we have the pleasure of meeting with Mariah Henderson-Cadigan, who is a physician assistant at Tufts University up in the Boston area. And I will let Mariah just introduce herself.
Hi, everybody. Thank you for having me. So as Alf said, I'm Mariah. I'm a physician assistant. I work in college health. And I also do education for physician assistant students on working with LGBT populations and specifically on transgender health.
Perfect. Thanks for being here today. We're excited to have you.
So we're going to start just by going through some definitions when we talk about sex, gender, sexuality. So because there's a lot of vocabulary and it can be easy to get things mixed up. So when we talk about sexual orientation, so this is, who or how people are attracted to other folks if they are. So words that we use for this, we talk about people being gay or lesbian, bisexual, asexual. There are a variety of words that people use, and we care about sexual orientation from a perspective of we want to know our patients and we want to know about their lives, but we also care about sexual behavior, which is what they are doing with their bodies and with other people. So gender identity is something that is separate from sexual orientation, and what this is how someone feels about themselves broadly, just in terms of maleness or femaleness or something elseness, none of the aboveness. It's a complicated, it's a complicated topic. It's not particularly easy to explain. Everybody feels and experiences their gender differently. People's sense of gender, may be something stable throughout their life. You're growing up and, you might think, oh, okay, I'm a girl. And then for the rest of your life, that's how you identify, identifying with the word woman later on. Some people, identify as one thing when they're younger, and that changes as they grow up. And the broad kind of categories that we use to talk about gender. So we can talk about people being cisgender, which means that their gender identity aligns with the sex they were assigned at birth. So somebody who identifies as a woman and at birth was identified as female. And we talk about people who are transgender as folks who identify with a gender other than the sex they were assigned at birth. So this could be somebody who was assigned male at birth and then down the road identifies as a woman or identifies as agender, not having a gender, being gender fluid or non-binary, so having a gender that isn't distinctly male or distinctly female. There's such a wide variety of words that people can use because there's just such a broad spectrum of genders, because it means something different to everybody.
So that's great. Thanks for sharing with us about gender identity. So for example, I personally was born male and I identify as a man, so I am a cisgendered male. So Mariah, I was wondering if you could touch a little bit on biological sex.
Yeah, so biological sex is, something that we can see and measure, and, it is something that we can see. So this is when somebody is born, the doctor says this person is a male or this person is a female. And biological sex doesn't necessarily fit into those two categories. There are folks who are intersex, and there are a variety of ways that this can present. So there are some chromosomal differences or hormonal differences, ways that people's bodies respond to certain hormones that can affect how they look, how their body functions, their fertility. Ultimately, with all of these things, with sex, gender, and sexual orientation, there's such a wide variety of experiences and bodies and relationships between people's identities and their bodies that, it's important to, have vocabulary and be able to listen and talk about this with our patients, so that we can really understand who they are and, what we can do for them.
So thank you for sharing that. So I wanted to touch a little bit on pronouns. Do you mind sharing with us the definition of pronouns or how those might differ?
So the short of it is pronouns are how we talk about other people when we're not talking directly to them. So there are gendered pronouns, so she, her, he, him, but those pronouns don't necessarily work for everybody. So we use gender neutral pronouns sometimes. And the most common one is they, them. And the way that you would talk about somebody is like, oh, I'm seeing that patient. They said that they're going to come in next week. Ultimately, we use that pronoun a lot. We use it if we don't know the gender of the person we're talking about. Oh, someone left their bag here. I hope they come back for it. So it does, on paper, it might seem strange to you, but in practice, it's something that tends to flow really easily.
So that's great. Thanks for sharing. So can you explain to us a little bit what that actually looks like in practice? Let's say you're seeing a patient and you don't know their pronouns. What would that look like?
So, it can look like just what you said, you don't know their pronouns, and defaulting to they is a very safe and respectful measure. It can be really distressing for trans folks to have the wrong pronouns used for them. If somebody, wants to be called he, and if those are the pronouns they use, he uses, see? But it might be really distressing for this person to get called she. And, if you have to take a guess, if you're not sure what someone's pronouns are, if you haven't asked, picking they is generally not going to be distressing for folks. And in terms of how you ask, a lot of medical record systems have a way of taking this in now. So when our patients check in, they get to list what name they want to be called by, which is a really important part as well, making sure that we're not just referring to patients by the right pronouns, but also by the right name. Not everybody goes by the name that they were given at birth. And this isn't just true of trans people. Some people go by their middle name and are never addressed by their, legal first name. But so when people check in at our clinic, they have a space to put the name that they use and the pronouns that they use. And we can, we'll review that when we start seeing the patient. We can confirm medication allergies, and I have on here that you use she and her pronouns. Is that right? And it's easy once if it's ingrained in your system, it's easy to remember to do it, and to make sure that we're charting on patients in a way that's affirming. That's the thing, is if you're talking to a patient, you're mainly using you. But in the notes, if somebody hasn't access to their medical records and they look and see that the doctor who has been affirming and respectful during the visit is charting on them and using the wrong name, the wrong pronouns, that still, that signals a lot of disrespect and might result in that person not seeking care with that provider again.